everyone. I am Johara Gelalgaman from BSN 111F. Today, I am going to demonstrate on how to put on and remove a sterile gloves. This is done to enable the nurse to touch the sterile objects freely without contaminating them and to protect the patient from contamination caused by pathologic organisms. But first, we need to know what is gloves and its purpose. A gloves is a protective barrier made up of latex or synthetic materials such as nitrile or vinyl that is used to prevent the possible transmission of diseases between healthcare professionals and patients during examinations and procedures. So, here are the purpose of gloves. Gloves create a barrier between germs and your hands. And wearing gloves helps protect both patient and healthcare workers from infection. Next one is wearing gloves in the hospital helps prevent the spread of germs from one person to another, and it helps keep your hands clean and lessen your chance of getting germs that can make you sick. Next is it reduces the risks of contamination of healthcare workers' hands with blood and other body fluids. And the last one is it is reducing the risk of germs dissemination to the environment and of transmission from the healthcare worker to the patient and vice versa, as well as from one patient to another. These are some of our safety considerations. First, choose the right size of gloves because the gloves comes in multiple sizes. Make sure that the gloves are tight enough so that the objects are easy to pick up. Then, the last one is the sterile gloving does not replace hand washing. Hands must be washed before and after any procedures. So this is our preparation before doing or performing open gloving. First, ensure the sterility of the package of the gloves. And then remove all jewelry. No artificial nails, extenders, or cheap nail polish should be worn. And then inspect hands for sores and abrasions. So first step is perform hand hygiene and observe other appropriate infection prevention procedures. And then it decreases the bacterial count on hands and prevents contamination of sterile equipment. And let it dry. The next one is open the package of sterile gloves without contaminating inner package. Place the package of gloves on a clean, dry surface. Any moisture of the surface could contaminate the gloves. And then, open the inner package according to the manufacturer's directions. Some manufacturers provide a numbered sequence for opening the flaps and folded tabs to grasp for opening the flaps. If no tabs are provided, block the flaps so that the fingers do not touch the inner surfaces. The inner surfaces, which are next to the sterile gloves, will remain sterile. And then, put the first glove on the dominant hand. Pick up glove for dominant hand by touching the inside cap of the glove. Do not touch the outside of the glove. Pull glove completely over dominant hand. And if the gloves are packaged so that they lie side by side, grasp the glove for the dominant hand by its folded cuff edge with the thumb and first finger on the non-dominant hand. Touch only the inside of the cup. hands are not sterile by touching only the inside of the glove, we avoid contaminating the outside. And then, put the second glove on the non-dominant hand. Pick up the other glove with the sterile glove hand, inserting the glove fingers under the cup and holding the glove thumb close to the glove palm. Then, pull on the second glove carefully. Hold the thumb of the glove first hand as far as possible from the palm. In this position, the thumb is less likely to touch the arm and become contaminated. Adjust each glove so that if it fits smoothly, and carefully pull the cups up by sliding the fingers under the cups. Protect your glove fingers to maintain sterility. Touching sterile only to prevent contamination. Once gloves are on, interlock glove hands and keep at least 6 inches away from clothing. Keep hands above waist level and below to the shoulders. This step prevents the accidental touching of non-sterile objects or the front of the gown or contamination. So that's all for the open gloving. So now, let's proceed on removing the sterile gloves. So first, to remove the gloves, grasp the outside of the cuff or palm of glove and gently pull the glove off, turning it inside out and placing it into glove hand. Doing this prevents the contamination of the hand when removing glove. Then take ungloved hand, slide fingers inside the remaining glove, and pull glove off by turning it inside out overhand. This step prevents the contamination of glove hand touching ungloved hand. Then discard used gloves inside the wrapper in an inappropriate container. And then, perform hand hygiene. This removes powder from the gloves which can irritate the skin. It also prevents contamination from potential pinholes in the gloves. That's all. That's all for the open and removing sterile gloves. Thank you.